Okay, now I think I'm live. Hi there. I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center, and I am here to talk to you about the difference between allergies and COVID. We all know that allergies are going on now for lots of people, and the symptoms might have a little bit of a crossover, and so we want to make sure that when you are having symptoms that you're not feeling the symptoms of COVID. So I'm going to go over both kinds of symptoms and I will go over what to do about them and how to handle it. And then I have a slide presentation that I will post here as a link later. Let's see if I can add it now. Uh, no, not yet. Okay. So the symptoms of allergies are, itchy eyes, runny nose, itching of your face, itchy skin. Sometimes some people will have rashes. Sometimes you'll have a cough. You may have a sore throat. You may have even difficulty breathing. So a lot of people who have bad allergies will get symptoms of sneezing and runny nose and wheezing. And the with COVID, of course, there is also sometimes a sore throat and a dry cough, not necessarily a wet cough, but also people can feel like they're short of breath when they're having symptoms of COVID, of course. And the difference in allergies versus COVID would be that so first of all, with allergies, a lot of people who have allergies already know that you have allergies. And so you may have them every year or every season at this time of year. And so if you already know that about yourself, then um, you'll be familiar with the symptoms. So the big difference really is with COVID, the symptoms can be also shortness of breath and cough and sore throat. But the big difference is a fever. Most people with allergies don't get fevers. And sometimes when you are having allergies, you can feel like you're hot, but with you may still not have a temperature. And so what I would say is if you're having allergy symptoms, take your baseline temperature and see what it is. Or if you're used to having allergies and you haven't got allergy symptoms yet, take your temperature now and kind of see what it is. And then if you start to have symptoms that might make you feel confused, then you can take your temperature again later and see if it's elevated, especially if you're feeling hot. Like I said, the big difference between allergies and COVID, of course, is a fever. What I would say, of course, is that if you are feeling really, really sick, or if you feel short of breath and you can't get control of it with any of your normal mechanisms, like some people who have allergies are able to use inhalers or may have inhalers at home. And if you use your inhaler and you don't get better, call for help. Do not ignore symptoms if they're getting worse or if they're worse than your normal allergy symptoms. Do not ignore them. Just go and get help or call the advice nurse or call 911 and ask for guidance or call your doctor. Anybody who's concerned about their symptoms, who's my patient, of course, you can call me and ask me, and I'll help you figure it out. But if you're short of breath and it's not getting better with your normal treatment that you do for your allergies or your inhalers, then call because you don't want to ignore something like that. Here's it's like kind of a good news, bad news thing. Having allergies is not fun, of course, but there are supplements that actually help allergies that will also help prevent COVID or help you fight it if you were to have it, which is super cool. I'm going to list those supplements uh, for you. Let's see. Uh, so, uh, okay. So, first of all, I wanted to go over the difference between uh, between COVID and allergies. One is that fever is more common with a virus. Also, if you've had similar symptoms in the past, you most likely have allergies. And antihistamines and inhalers will help you if you have allergies, but they won't help you if you have COVID. So just to review that. And there's a whole list of supplements that help allergies that can also help prevent COVID, which I'm super excited about. So one of them is quercetin. And quercetin is the inside of an orange peel or lemon peel. Is that white part of the orange peel or lemon peel, and it helps. When you have allergies, what's happening is that you have cells that are called mast cells, and they are being attacked by whatever the pollen is, and the quercetin helps stabilize them. So it acts actually as a natural antihistamine, because that's what antihistamines do too, is they protect you from the allergic reaction. And so quercetin is super cool. And quercetin also acts as an antiviral because it protects the cell from being invaded by the virus, especially the COVID virus. So it kind of has a double-edged treatment possibility. And another treatment for allergies, there's actually several companies that make formulas that have all of these things in one formula. So you could get like an immune support supplement that protects you against allergies that could also be helpful in case you got something like COVID. So the other thing that helps with allergies is called stinging nettles. And stinging nettles are an herb. You've probably seen them in the fields. So they usually look like a weed. And they help protect your immune system against allergies, but also may help fight viruses. So they're a super duper good herb for this time of year. You can also buy stinging nettle tea, which actually tastes pretty good and can be very soothing. It's like it takes away the itching that you get in your palate and in your eyes when you're having allergy symptoms. Another supplement that helps allergies is vitamin C. And vitamin C, of course, is also protective for your immune system in lots of ways, and has been shown to help people who have had COVID. It seems to help lower or reduce the length of time that they're sick, and may actually help protect their immune system from getting too sick. But vitamin C also acts kind of like a natural decongestant. So like when you're all congested and with allergies and you have the sneezing and snuffling, if you take vitamin C, it will act as a natural decongestant, and it'll help dry up your secretions. And again, doesn't have the drug effect. And the best way to use it for that is either you could buy powdered vitamin C, or you could buy, if you could do the powdered, what you could do is you could put it in water and kind of drink it throughout the day, so that it kind of keeps you your mucus less throughout the whole day, so that you can enjoy that, not feeling all stuffy and congested. Another supplement that's good for allergies is an herb called skullcap. And that's actually a Chinese herb, or a pretty popular Chinese herb. And that is also really good for protecting you against viruses. And it's an herb that is a natural anti-inflammatory. And so in allergies, what's happening is there's a lot of inflammation in your immune system, and again, with different people it's different symptoms, but it helps keep your immune system strong, and it helps protect you against the inflammation that you get with allergies. But it also has an antiviral effect, and so again, it has sort of that crossover, which is super fun and cool. And then another supplement that's helpful, and I'm going to address supplements for immune protection as well, is N-acetylcysteine. And N-acetylcysteine is a supplement that is does a lot of different things, but again, it acts as a natural decongestant. Many years ago, I used to have really bad congestion all the time, and I sort of accidentally took um, a supplement that had quercetin and N-acetylcysteine in it. And I remember I was so stuffy. And it's not that I accidentally took it, but I found a bottle that had these things in it. And I've found that a lot of us doctors and scientists, we figure things out sometimes by trying them on ourselves. And anyway, it cleared up my nose completely for the first time in days, and I was able to breathe through my nose. And I was like, what is this? So I did all this research to figure it out. Anyway, N-acetylcysteine is a component of glutathione, and it's a precursor for making glutathione. And glutathione is the super antioxidant in your body, and it helps your liver do its job. So every single time that your body detoxifies one molecule of a chemical, the glutathione is one molecule of glutathione is used up, and N-acetylcysteine helps you make glutathione. But it also has a side effect of clearing up mucus, so that when you're congested from allergies and a lot of stuffy nose and things like that, it gently helps clear that up. And as you know, I don't know if you've experienced this, but when you take over the counter decongestants that you can buy in a drugstore, they can dry you up, but they cause your nose to be so dry that it's almost painful. Plus, as soon as it wears off, you kind of feel more like your nose is even doubly worse. And N-acetylcysteine and vitamin C act as a decongestant without causing that sort of rebound effect, and they help you in building up your immune strength. So they're also doing something good in the background, whereas the drugs that are decongestants really act temporarily and they won't necessarily do anything good in the background. So may as well use something good for you that will protect your immune system. I am trying to see if you guys have questions, and let's see. No, there's no live questions. Oh dear. Let's see. Okay, good. Okay, I can see questions. Sorry. I'm still not so experienced at lives, so when I do them, I always have to figure out how it works. I'm going to talk about immune protection and taking care of your immune system. And basically, in my world, everything is about balance, and everything is about maintaining your health and keeping yourself strong and healthy no matter what is going on. So right now, of course, we're all doubly challenged with the amount of stress that's going on, and with being sheltered at home with this coronavirus pandemic. And so there's a lot more going on than maybe normally would be, although stress is stress, really. And this is a perfect time to think about your health sort of on a global level. And I always think about, like, I have friends who are other physicians, who are other integrative physicians, who have had family members get sick or who have had the coronavirus themselves. And they all have recovered fairly well, partially because they are already healthy. And so that's the whole point, is what does it take to be really, really healthy already? And you can take supplements, but you can also just maintain your health in certain ways. And of course, the main thing is that you want to Emily is asking what vitamin C. Well, powder form vitamin C is not necessarily the best, but if you're using it as a sort of like if you tend to be congested over the course of a day while having allergies, then you want to take more vitamin C. And if you kind of spread it out throughout the day, then you will have more of the decongestant effect. So it's not necessarily that it's the best, But if you have to take a lot of it throughout the day, then that is the best way to do it, because you can kind of put it in a bottle of water and just drink it throughout the day. Whereas if you're taking capsules, then you have to remember to take them at different times. Now, if you tend not to be super congested, then you might just take a dose of vitamin C in the morning and a dose of vitamin C in the evening, and that will be enough for you. So then you could just take capsules or a pill or something. Uh, so I was saying, okay, so just overall taking care of your health. So the things that take care of your health overall are the same as what you already know. You want to eat healthy food. I always say eat a rainbow every day. And what that means is different vegetables that are all different colors. So, like purple cabbage, red beets, orange carrots, celery, greens, arugula, lettuce, like throughout the course of the day, all different kinds of vegetables. And the more vegetables you eat, the healthier it is for your body. And that is no matter whatever else you eat. Um, but if you eat plenty of vegetables, that will help sustain your immune system and and help your body be overall healthier. Not to mention that if people are struggling with weight loss, vegetables are a really good way to lose weight. And then you want to keep your stress down. You want to do deep breathing and meditating. You want to get plenty of sleep, especially during times that are sort of higher stress. And when you add a whole bunch of different things together, that it kind of builds a picture of excellent health and balance. And then specifically, if you want to take care of your immune system, there are certain supplements that kind of like, if you are already doing all those things and you feel like you want more support for your immune system and your overall health, then you want to take certain things to help support that. Now, in general, what I say is that it's good to take a good multivitamin, because that provides you with the minerals and the basic B vitamins and sort of like a overall basic, so that you don't have to take 20 pills a day in order to make one set of things work right. And having a good balance of minerals and vitamins is helpful. But then there are some specific supplements that help your immune system specifically, and so I'll talk about those. Of course, zinc is been shown and has been talked a lot about during this epidemic or pandemic. It may work by preventing viruses from multiplying, but it's also really important for helping support your red blood cells and and keeping your oxygenation of your tissues going well. Vitamin C also has many benefits besides what I talked about for allergies. It helps your immune system, but it also strengthens your connective tissue. And I don't know if you have known anybody, or maybe you have, if you ever get a cut and it takes a really long time to heal, then that probably means that you're somewhat vitamin C deficient, because if your tissues take a long time to heal, it's because your collagen and your connective tissue isn't strong, and that would be a sign that you would need more vitamin C. Um, and I'm going to answer your question in just a minute, Molly. Okay, I'm going to finish this thought and then I'll answer that question. And Vitamin D. Vitamin D is sort of another super vitamin. It's actually probably more hormonal because it helps support your immune system. It protects your immune system and it enhances your immune system's function, but it also supports your hormones and your nervous system. And there are certain supplements that help all three, what I call the triangle of wellness. So your hormones, your nervous system, and your immune system are what I call the triangle of wellness. And that's for all the years that I've done medicine in the way that I do it, I've dealt a lot with people who have mystery illnesses or conditions that nobody else seems to be able to diagnose, and maybe we haven't been able to find a diagnosis. It's part of why I do Chinese medicine and Western medicine. But one of the one of the things that I figured out over the years is when somebody has a condition that we don't understand, that there's sort of this triangle that if you support all of the legs of the triangle, then basically you can recover from anything. So that would be again your hormones, your nervous system, and your immune system, and vitamin D and omega 3s and B complex are all supplements that help support all three of the legs of this triangle. So taking omega 3s, taking vitamin D, and having a good component of B vitamins and minerals is sort of the support for this system so that it can function. And if you get all of the legs of the triangle going, then you would be able to basically have the substructure for your body to heal from anything. So that's how I think about things. Okay, I'm going to read Molly's question. So your daughter has a deviated septum and a jaw pain after sleeping, and she's congested. No, Molly, that doesn't make sense to treat the jaw pain that way. What you want is to figure out what's causing the congestion. And you know those breathe strips that you can buy them at the drugstore. Maybe have her try that because it might just gently pull open the airway so that she can breathe through her nose at night, and see if that works. Also, taking N-acetylcysteine and maybe vitamin C will help open up the airways so that reduce the swelling inside the airways, and see if that helps. Because the jaw pain is probably not from the sinus congestion. It's probably from clenching her jaws. But see if that helps, and I'm happy to talk to you about it as well. Oh, it's nice to see you outside the office too, Lindsay. It's so nice to see all of you, Heather and Deborah and lots of Nancy. My goodness, it's so great to see all of you. Okay, I'm going to continue with my talking here. So I talked about vitamin D and omega-3. So just one more comment about omega-3. A lot of people take omega supplements, and you want to make sure when you take an omega supplement. So eating fish alone isn't going to give you the omega-3s, and plus a lot of fish nowadays are full of mercury or full of other heavy metals, or also been exposed to various toxins in the ocean. And so getting a really high quality omega-3 supplement, this is probably one of those places where it's kind of harder to get it in your food than it is to get it in your in a supplement, because when you buy a high quality omega-3 supplement, it is filtered so that the heavy metals and the radiation are not in the supplement. And what you want to make sure of is that it has enough omega-3, EPA, and DHA. And so there are vegetarian sources of omega-3s that have DHA. So for those of you who are vegans or vegetarians, you can buy a vegan DHA omega-3. And then if you don't feel the need to do that, then your best bet for getting enough DHA is to buy a fish oil that has been filtered. Okay? And again, the omegas support nervous system, immune system, and hormones. And you can get omega-3s, just to put it in your diet. There is the ability to get your omega-3s in your diet, but the DHA component only comes from the sea. So it either comes from seafood or algae, and that's it. That's where DHA comes from. And that's the part that's most important for taking care of your nervous system. So for my patients who have had head injuries or who have brain issues, you want an omega-3 that has those things in it. Um, and glutathione. So the next thing is glutathione. And I've already mentioned glutathione briefly. So glutathione is a super antioxidant. Um, back a couple years ago when we had the big fires, glutathione is also a really good supplement when your body is really under stress. But in the case of the fires a couple of years ago, or actually even last year, we had a big fire. Um, the glutathione helps your lungs, uh, and it helps open up your airways. So, and there's a particular way you can actually get glutathione prescribed in order to use it as a nebulizer. So, if you have asthma or you have lung issues, glutathione can be inhaled and it helps reduce the inflammation in your lungs. So that's a very helpful thing if you are a person who struggles with really bad allergies or has asthma. It may help prevent the inflammation in your lungs. It's more of a preventative than as a treatment for, like, if you're having trouble breathing right now. If you're having trouble breathing right now, you need something like a medication or acupuncture. I can actually help with wheezing with acupuncture. Like, I can open up the airways in just minutes using acupuncture. Um, and so glutathione is an antioxidant. It helps protect your liver, and it helps your liver do its job of detoxification, and it helps your airways and your lungs. So it's this super supplement for many other things. Um, oh, nice to see you, Rena and Kona, and my goodness, Deborah. If you guys have questions, just let me know. I'm going to talk just for a little bit longer, and then if you have more questions, I will answer them. So another element of using glutathione when you have allergies, or when you're sick, or when you're trying to detoxify, is that it supports your liver. Now, in Chinese medicine, springtime is the time of year that the liver is most active. And allergies, of course, they're most often bad during springtime. And so, even though a lot of allergy symptoms are like respiratory, you have sneezing and itchy eyes and runny nose and things like that, it's the liver in the Chinese medicine system that makes it worse. And so, you always, if you have allergy symptoms or you're prone to allergies, you don't just want to support your respiratory system, you want to support your liver. You want to make sure that your liver is getting care. So, like when I do acupuncture for allergies, I'm working on your liver to help the liver handle its detoxification. This is also a really good time of year to do a cleanse, which is why I'm always suggesting that you do my spring seasonal reboot, because um, it simplifies your diet and makes you less likely to eat the foods that would make you sneeze or have a runny nose. And it also makes your liver healthier, and it supports your liver in doing its job. And so it does all kinds of things to support you when allergies are going on. Hey, Jen, nice to see you. Um, so nice to see all of you. That's great. I wish I could see your faces. All of us sheltered at home. It's hard to see a face these days, except on video, isn't it? Um, okay, if you have any questions, I will answer them, and if you don't, I will get off this call right now. So, Kona, you're asking if I do IVs. I do not, but I do inject vitamins intramuscularly. So I can inject B vitamins, magnesium, and vitamin C, but I don't do any IV vitamins. Hi, Rena. And yes, that was the answer to that question. I miss you too. And um, so I will ask a question on your behalf. This whole thing with the COVID and how to protect yourself. What I want to say about any illness like COVID or the seasonal flu or a seasonal cold or any kind of flu that you get, the focus is being well, and the focus is thinking about your wellness. And um, in this time when things are so stressful and so difficult, still it's possible to believe in your good health and to do your best for your good health. And you want to really focus on that, even if you have health conditions. Most of you, if you may have lived with some health condition over time, or you may have some health challenges, we want to call them, over time here and there. But if you always believe in your good health and you really work towards overall big good health, that is your best protection against anything. Is just taking care of your body, taking care of your mind, taking care of your spirit, and in any way possible, doing those things is going to help you more than anything else. The rest of it is not in our hands. I mean, of course, washing our hands helps us, and isolating from people helps us, so there are things that we're all doing, but we're doing everything within our control, right? So, okay, I was just reading comments. So we're already doing, by staying at home and taking care of ourselves as much as possible, we're doing as much as possible for our health, right? Then beyond that, taking certain supplements, and then beyond that, the most that you can do is really just focus on keeping yourself healthy and strong. So if none of you have any more questions, I'm going to sign off on this. And if you have more questions later, you can write them in the comments. I will come back to visit and see what the comments are. All right, everybody. I hope you're doing great and take care of yourselves. I'll look forward to seeing you again sometime soon. Oh, the cleanse. So I'll post a link to the cleanse here in just a minute, but the cleanse is usually $250, and I'm selling it this season for $197. It's a 2-week cleanse. And okay, that's it. Thank you so much. Nice to see you guys. Hi, Barb. Hi, Mary. Mary, I'm sorry I'm going to be signing off in just a minute, but you can watch the video later. All right, take care, you guys. Bye-bye.